All right, today we're going to be doing an assessment of the gastrointestinal system, the breasts, and teaching how to do a self-breast exam and a testicular self-examination. For the GI system, first of all, you want to give an overall picture of the patient. The patient is calm, does not look like he's in any distress. You have the patient lie supine with the head in about a 30-degree angle and the knees up to keep the abdominal area as comfortable as possible and as soft as possible. The first thing I'm going to do is inspect the overall skin and look for any scarring or perhaps at the umbilical level some kind of a hernia. After you inspect it and there is nothing irregular that is apparent upon inspection, then after that, then you do a general auscultation. So I will use the diaphragm of my stethoscope and I will listen to all four quadrants of his abdomen. The upper right, which is quite active, sounds at least once a second. Upper left, the same. Lower left, and lower right. So I would call his abdomen hyperactive. And then I listen with my bell, and I am going to listen to several of his arteries. First of all, to the aortic artery. I hear no bruits. And then go just to underneath his rib cage on both sides. For his renal arteries, I'll go down to find his iliac crest with my bell and listen for an iliac artery bruit, which I don't hear one. Identify his femoral artery and listen for to his femoral artery for a bruit as well. Once I have completed that, then I'll start with light palpation. Gently, I will feel all around his stomach, look for grimacing, and look for any kind of guarding that he might have. Does any of this hurt?
No.
Excellent. Once I've done that, then I'll go in for a more deep palpation throughout the belly, feeling for masses. There are no palpable masses as I'm feeling through. I'm going to come over to this right, and I'm going to try to hook under and feel for his liver. If you could please take a big deep breath in and then out. And when he holds it out, I will feel under a little bit for his liver. The liver is not palpable, so then I will attempt to percuss it. So first I get a good feel for what the general percussion sounds of his belly are, and he's pretty tympanic throughout. So then I'll come back over to the liver and try to palpate up. And I'm really having difficulty finding the lower edge of the liver. If you could lay over onto your right side for me, and I am going to try to palpate for the spleen. And I'm really having a hard time finding that there as well, but it would be at the 6th or 7th rib if I was able to palpate for it, but I am unable to palpate for the spleen. Could you please stand up for me? And I am going to percuss your kidneys for the costovertebral angle. Does any of this hurt?
No.
No. Excellent. So I'm going to do this. And let me know if this hurts. Does any of that hurt?
No.
Excellent. That's all for now. Thank you. So now I am going to discuss how to do a self-exam of the breasts and of the testes. For the breasts, a woman should ideally do a breast exam 5 to 7 days after finishing her period, standing in front of a mirror, be able to inspect her breasts in 4 different positions, with her hands on her hips, hands straight down, hands behind her chest, and then leaning forward, hopefully looking for any differences, for any flatness, for any asymmetries, for any dimpling or retractions that might show up from these different positions. So then you tell the patient to lay back with her hand over her head, potentially behind her head, and also to do this again with her arm just straight out. And what she wants to do is feel up and down with the second, third, and fourth fingers. Go straight up and down all the way across, and do this for both breasts. And also do it this way, with the hand above the head, hoping to elicit some kind of a lump. Make sure to encourage the patient to concentrate on the upper outer portions of the breasts, the tail of Spence, because this is the most common area of where lumps are found, but really very few cancers are found. Only about 5% are actually found from lumps, but they are found, so it's important to still do this. You're going to look for any nipple discharge. That would be a non-normal finding. And then if there are any rashy areas around the areola, if the areola is irregular in between each breast, if there's any nipple inversion, if the skin has any dimpling, to please seek and if obviously if there's any pain or lumps that are found, to immediately seek medical assistance. As far as the testicular exam should be a self-exam should be performed right after a shower, a nice warm shower, and the patient should again, in front of a mirror may be helpful to move the penis out of the way, but also to inspect it and to move the glands, to remove the prepuce if it does exist on the patient, and then to examine the glands, to examine the penis, as well as hold the scrotum with the sort of cup them with your hands, feel with your thumbs, one at a time on each testicle for any lumps, to also examine the epididymis behind the testes for any lumps as well, that normal finding would be to have no masses in that area, to look for any hernias in their inguinal areas, and if they find any irregularities in the size, the shape, any pain, any nodules, that they should have that checked out immediately. Their urethral meatus should be central, so it should be medial, right down the back side of the penis. There should be no evidence of penile discharge. There shouldn't be any skin excoriations. Any skin excoriations could indicate, lice in the area, for instance. Thank you very much.